A $200 million a year pay parity fund for community-based nurses and healthcare workers announced recently has been met with disappointment by some Māori health providers who say it leaves out their general practice nurses. To speak more to this, National Hauora Coalition Clinical Director Dr. Ranch Johnson no Ngāpuhi, Ngāti Korokoro, Ngāti Wharara, Te Pouaka is with us now. Tēnā koe, Dr. Johnson, thanks for joining us.
Kia ora.
Now, give us an idea or an overview on the pay parity agreement and why it's limiting for some Māori nurses and providers.
Yes, well, last week Minister Little announced this pay parity agreement to give pay parity for many community nurses with the nurses working within the hospital system, but it did not include general practice nurses. So it's going to be rolled out over the next 2 years, and the targeted groups include aged care facilities, hospitals and home care support and other residential facilities. But unfortunately, general practice nurses are not included in the initial pay targets, pay parity targets in either the first or second rollout.
Health Minister...
it's very disappointing.
Yeah, well, Health Minister Little has said aged care facilities and Māori and Pacific healthcare providers will receive the first $40 million tranche of the funding. Do you feel this is a step in the right direction?
Well, yes, we're very pleased to see that Māori and Pacific providers have been targeted in the first rollout to receive this pay parity action. But unfortunately, many Māori providers, their services are based around primary care and general practice services. So those services that are subject to pay parity will only be the contracts that are directly funded by Te Whatuora or Taka Whaiora, and does not include the general practices.
Why do you think the Minister has left out general practices from the initial allocation?
Well, he stated that he did not see sufficient evidence of the pay gap. I think we can dispute that, because we know that primary care nurses currently earn up to 20% less than hospital-based nurses. So I believe that the reason that general practices have been left out is because general practice funding is complex. Te Whatuora does not directly pay general practice nurses' wages, and so in order to effect a change of that, they're going to have to look at the way in which general practice is funded. So some general practices are private businesses, and they may be able to afford to take money from one service and put it into meeting the nursing staffing, but most providers, including our Māori and iwi providers, cannot afford to do that. So the main way that general practice is funded is through capitation, and it needs to be changed. So 2 weeks ago, a report from that was made for the Health Transition Unit was released that looked at a future capitation funding approach. And it found that the current general practice revenue is well below the true cost of delivering care. And it recommended, sorry, my lights have gone off, it recommended a change to the general practice services funding based on ethnicity, deprivation and morbidity, which would lead to large increases to higher needs practices. So we definitely need to look at the way that general practice is funding so that we can deliver appropriate wages to our nurses and provide appropriate equitable healthcare.
Dr. Johnson, some of these frontline clinics have been providing critical care during COVID-19. What are some of the implications of this on top of the challenges from the last couple of years?
Yes, definitely. Over the last over 2 years, our general practice nurses have been under huge pressure. They've been delivering COVID testing, COVID vaccination and COVID care in the community, and our teams are exhausted. We're also, currently with GP shortages, our nurses are working really hard at the top of their scope to fill in these gaps in staffing. And so by leaving our GP nurses out of the planned pay parity funding, it's a real slap in the face and leaves our general practice nurses feeling undervalued by the system. We've already seen huge challenges to staffing, and it's only going to get worse if our primary care nurses are not paid the same as other community and hospital nurses.
And then, of course, we have the rural health workforce, which is already under crisis, who are already having a major problem here. National Hauora Coalition Clinical Director, Dr. Ranch Johnson, thank you so much for your time today. Ngā mihi.
Kia ora, thank you.